Welcome back. So, how can we determine if our clients are experiencing chronic inflammation? What tests can be done to verify that they are truly having chronic inflammation? Well, these are the tests that I have come to find very useful in my consulting with clients at the pharmacy. Full blood count. Full blood count because we will be able to see the values of the lymphocytes and the monocytes and the neutrophils, which are blood cells that are involved in inflammatory response. There is a way they appear that could cause us to begin to suspect this person might be having chronic inflammation. Then we have ESR, erythrocyte sedimentation rate. Now, this is one simple, common inflammatory marker. Any ESR above 20 should be looked on as could this person be experiencing inflammation, chronic inflammation. Urinalysis, we begin to see protein in the urine. We begin to ask ourselves, could this be inflammation going on, chronic one? CRP is another test. C-reactive protein is a marker for inflammation. Then we have homocysteine. Those ones are more expensive, but if the person can afford to do homocysteine test, very, very okay, because it's one important inflammatory marker and it's closely connected with some some serious diseases like cardiovascular disease and even cancer. Vitamin D3, because vitamin D deficiency or insufficiency is becoming a growing epidemic, and vitamin D is seriously involved in an anti-inflammatory processes in the body. It's also good to check vitamin D. I've come to find out that the lower the vitamin D level in the person's body, the higher the chances of chronic inflammation. And then liver function test, as I said before, it's the liver that detoxifies the toxins, and so when it gets over labored, it just sluggish, it doesn't do, it's not more as efficient as it is to take out toxins. And of course, when toxins are beginning to build up, it can lead to chronic inflammation. So it's good to check the function of the liver. So these are tests I generally recommend for my clients. And depending, it may not be all at a time, but depending on what we consult and what we hear the patient talking about, that determines, and of course, financial factors also determine what and what tests we'll send them to go and do. Thank you.